you so much. Well, good afternoon, everyone. Thank you so much for taking time out of your busy day to join us for this session of GMN Insights. And as Lori said, my name is Babs Hall, and I will be providing you a very quick and compact session regarding an overview of Georgia's area agencies on aging, as well as our Aging and Disability Resource Connection, or ADRC. Please know that the slides will be provided at the end of the presentation, so we're going to cover a lot of information pretty quickly. So hang on, and I'll look forward to covering this with you. Of course, we're going to be focusing on stronger families for a stronger Georgia. And also, I just want to begin with making it known that I don't have any relevant financial relationships that would cause a conflict of interest in today's presentation. Also, we have our vision and mission for the Georgia Department of Human Services and Division of Aging Services. And I think you'll hear more about how this is carried out through the programs and services that we deliver statewide. So today's learning objectives, I'm going to provide a very broad, high-level overview of the Georgia Division of Aging Services. Then we're going to focus down a little bit more on the role of the area agencies on aging. So if you're not already connected with your local area agency on aging, hopefully after today, you'll see the value in making that connection. And then we'll talk about the functions of the Aging and Disability Resource Connection, and those exist within each of our AAAs, or area agencies on aging. And then I think the meat and potatoes of the discussion today is going to be around an introduction to home and community-based services. So how can the services available through our organizations and our state agency help support the individuals that you work with, as well as the families, the care partners, and the professionals that make up that multidisciplinary team? Of course, we're going to walk through how to access services and supports. And then if we have time available at the end of today's presentation, we'll be happy to entertain any questions you have and provide you some answers to those. So, from the big perspective, we have the Georgia Department of Human Services. So we are a state agency located, our central office is in downtown Atlanta. For ages and ages, we have been at 2 Peachtree Street, but we are currently in the process of moving over to Trinity, which is a little bit closer to the state capitol. But within our organization, we have 3 main sections or areas. So we have our Division of Aging Services, we have Family and Children Services, and we have Child Support Services. So a little bit of a hodgepodge there, but we all fit together under this big umbrella of the Department of Human Services. So of course, you and I are going to talk about the Division of Aging Services today, but just so that we can be clear on what other services are provided by our agency. For Family and Children Services, this would include both social services, including child welfare, foster care, and adoptions, but that also includes the financial benefit side of DFACS. So that would include Medicaid, TANF, or temporary assistance for needy families, as well as SNAP, or food stamps, you may know it as. And then, of course, Child Support Services is exactly what the name implies. It is the Office of Child Support Services and Enforcement that helps to ensure that children are financially supported by their non-custodial parents. So let's talk about the Division of Aging Services and what that looks like. Today, we're going to talk about primarily our ADRC and HCBS, but also wanted to give you just a high-level overview of Adult Protective Services, which I'm sure you're already familiar with as mandated reporters, and also our Public Guardianship Office. So these are the 4 main areas that fall under that big umbrella of Georgia's Division of Aging Services. So real quick, as you already know, Adult Protective Services is the state entity which is charged with investigating all reports of suspected abuse, neglect, or exploitation of older adults age 65 and older as well as any adult who is 18 years or older with a disability who does not reside in a long-term care facility. Next, all the way to the right side of your screen, you see Public Guardianship Office. So this office exists when there is no willing or suitable person to act as the guardian for an adult whom probate court has determined lacks sufficient capacity to make or communicate significant responsible decisions concerning their health and safety. In this case, DHS could be appointed as the guardian of last resort. So that is the function of our Public Guardianship Office. Again, today's presentation is really going to focus on the Aging and Disability Resource Connection, or ADRC, as well as home and community-based services. So what's our structure look like? In the state of Georgia, we have 12 area agencies on aging, which are designated in our map here to the left. You will also notice that these regions in this map is the same map that our Department of Family and Children Services uses. So it's broken up in the same way. And each of our area agencies on aging are designated to address the needs and concerns of older adults. Also, another function of our area agencies on aging is to coordinate and offer home and community-based services. So, by making a range of services available, area agencies on aging help make it possible for older adults and individuals with disabilities to help stay in their own home or in the community of their choice as long as possible. So, we're going to talk about how we make that happen. As I mentioned, we have the Aging and Disability Resource Connection. So this is the team that I oversee at the state of Georgia. And the ADRC seeks to address the frustrations that many older adults, professionals, and caregivers, as well as individuals with disabilities experience when trying to navigate the long-term care system. If you've ever tried to navigate a governmental system, you know there can be multiple phone calls, multiple emails. Sometimes people say, I just want to get a human on the telephone. How do I reach a person? So our ADRC department, our goal statewide is to help alleviate that. We want to be a constant for the individuals that you serve, but also for you as professionals. So our goal is to raise visibility about the full range of available options, provide objective information, counseling, and assistance. We're also going to be empowering individuals to make informed decisions about their long-term care. And also, we're going to help people access services. So you see here, our first point is that we provide unbiased, reliable information and assistance. So unlike some agencies who seek payment from their referral entities that they make referrals to, the state of Georgia does not do that. We do not promote one program or service over another. Our job is simply to collect factual information and to share it with individuals who are seeking that information. As noted here, we do provide referrals for both publicly and privately funded services. So with that being said, we serve individuals of all income levels. It does not matter if someone has zero income and no assets, or if someone is wealthy. We can certainly help direct them to the appropriate services that meet their income needs and their assets. Also, another function of the Aging and Disability Resource Connection is to conduct eligibility screenings and assessments. So whenever an individual comes to our ADRC, whether that be by telephone, by walking in the door, by sending an email or submitting a web referral, or by being referred by a provider or a medical provider such as yourself, we are able to meet with that individual where they are one-on-one, whether that's by telephone most of the time, or it could be face-to-face. And we're able to conduct those eligibility screenings and assessments to determine what services they would qualify for. Oftentimes, when a family is in crisis, they don't know what they don't know. And sometimes you can ask people what they need, and they don't know what they need. So our goal is to help provide those options for them, talk through those options, and help them make a best informed decision as they can. Also, you see that we're referred to as a no wrong door model. So what this means is that if you come to us, regardless of what your question is, we will be the right door for you. We will help connect you to who you need to be connected with if we are not the right person. So ADRCs play an important role in this no wrong door model. This is a collaboration between the Administration for Community Living, the Centers for Medicare and Medicaid Services, as well as the Veterans Health Administration. And so the goal is to help streamline access to these home and community-based services, both publicly funded as well as privately funded. So we work in collaboration with all of our partners across the state. This includes other state agencies, this includes federal agencies, as well as small organizations and nonprofits. So the ADRC is just this intensive network where you can access all of this information. So who can contact us? It's pretty simple. We take calls from anyone and everyone. So we primarily serve older adults. However, we also do serve individuals with disabilities of all ages. Additionally, we serve caregivers and professionals like yourself. Here I have a wide variety of home and community-based services that are offered through our area agencies on aging. Some of these are offered directly at the physical area agency on aging in your particular region. And some of these are services that are brokered out to providers in your area that contract with that AAA. So I'm just, again, we're only have a short amount of time, so I'm just going to run through these super quick. But our senior nutrition program, that can include congregate meals, where older adults come into a senior center and receive a healthy, nutritious meal. Or it can include home delivered meals or meals on wheels, as you may know it. We also have our health and wellness programs, and this includes health fairs, health screenings at our senior centers, as well as evidence-based programs such as Tai Chi for arthritis or chronic disease self-management classes. We have a wide variety of health and wellness programs to fit the needs of older adults and individuals with disabilities. We also offer home modification services. So if an individual needs a ramp for their home, or they need accessible doorways or accessible bathrooms, those are areas that we can assist with or make appropriate referrals. We also work very closely on assistive technology with our partners at Tools for Life with Georgia Tech. They are the official assistive technology resource for the state of Georgia. So we're able to work one-on-one with individuals who may benefit from assistive technology in their home to help them continue to remain as independent as possible, continue their activities of daily living, and do so all in the comfort of their own home or the community of their choice. We also have community options counseling. So just as the name implies, it's an opportunity to sit down with an educated subject matter expert in long-term care services and supports, and they can walk you through what your options are and help you develop a service plan based on what your needs and wants are to help achieve those goals. I mentioned our home delivered meals program. Homemaker services, which can be light housekeeping, such as mopping, sweeping, other things that older adults or individuals with disabilities may have challenges with. We also have our care transitions program. So you may hear this referred to as Money Follows the Person or nursing home transitions. And this is the program for individuals who may be in a long-term care facility or nursing home who want to transition back into their own community or the home of their choice. So we do have staff available and programs that are able to assist those individuals both with obtaining the services they need to do that, as well as obtaining the financial resources needed to make that happen as well. Of course, caregiver programs and services. We know that those of us who provide care for other older adults or family members, we often need care ourselves. So we have a variety of educational as well as support programs for caregivers. As many of you know, open enrollment for Medicare opens officially, Monday, actually. So we have our State Health Insurance Program, or SHIP, formerly known as Georgia Cares. And this is the arm of the Department of Human Services that helps educate older adults on their Medicare options, both Parts A, B, C, and D. It's an unbiased organization or program that allows individuals to get information that is not soliciting them to purchase a service. We don't receive any financial benefit from that. So it's a great free resource available to all older adults. We also have our Elderly Legal Assistance Program, which is for adults 60 and older. This is specific to non-criminal matters, but this can include everything from accessing Social Security eligibility or assistance with applying for Social Security disability. It can include helping individuals with related to their benefits for VA benefits, Medicare, Medicaid benefits, or it can be older adults that may possibly have been victimized or the victims of fraud to help address those legal needs. Excuse me. There is no cost for these services, and it is also not based on income, so there is no means testing for this. So any adult 60 and older, as long as they live in the state of Georgia, is eligible for services through the Elderly Legal Assistance Program. And lastly, we have our Senior Community Service Employment Program, and this is for our older adults who have a desire to have that encore career or engage in other community services and employment. Some of you may be familiar with our Medicaid waiver programs here in the state of Georgia. We do have two elderly and disabled waivers, the Community Care Services Program, or CCSP. We also have the Source Medicaid waiver, or service options using resources in a community environment. For the purpose of today's presentation, we're really going to focus on CCSP because that is the waiver that our area agencies on aging complete the screening and eligibility assessments for. But did just want you to be aware of the other Medicaid waiver programs here in the state of Georgia. So in addition to CCSP and Source, we also have the Independent Care Waiver Program. And this is for adults with physical disabilities or traumatic brain injuries. Also, we have the New Options Waiver, or NOW, and the Comprehensive Supports Waiver, or COMP. And those two waivers are specific to individuals who have an intellectual or developmental disability. So all of these Medicaid waivers fall under our state Medicaid authority, which is the Department of Community Health, but they are administered by different organizations that contract with DCH to provide those services. So let's talk real briefly about Community Care Services Program, or CCSP. As you see here, I have outlined the criteria for eligibility in this program, which includes a functional impairment caused by physical limitations. So this would be inclusive of older adults or individuals of any age with an Alzheimer's or related dementia diagnosis. This program does require an approval by a physician related to an intermediate level of care nursing home placement. So this program is designed for individuals who qualify for nursing home placement, but who would prefer to receive services in their own home or in their community of their choice. Individuals do have to be Medicaid eligible or potentially eligible based on a financial screening, which our ADRC staff are able to complete. And also the individuals have to be Medicaid eligible after admission to this waiver. So related to Medicaid, I said that we served individuals of all incomes. So based on Medicaid income limits, some individuals may have a cost share that they have to pay in order to receive the CCSP Medicaid waiver, but others may not. So I encourage individuals, don't try and figure it out by yourself. Call one of our AAAs or our ADRCs to speak with someone so that you can go through that complete screening and assessment to see what services you may qualify for and if there may be any cost to you. Also, services are dependent on the individual's continued financial eligibility for the program. as well as their continued need for nursing home level of care. So how do we determine if someone is eligible for the Community Care Services Program? We're going to look at two domains. We're going to look at their level of impairment, but we're also going to be looking at their unmet needs. So you see here on the left, I have 6 in bold activities of daily living, and then we also have towards the right-hand side that doesn't appear in bold print, our instrumental activities of daily living. So these are the 15 areas that we're going to look at when we complete a determination of need revised or a DONR assessment. We're going to look at, again, the functional impairment of the individual in each one of these areas, as well as any unmet needs that the individual may have related to any of these areas. And from there, they will receive a score that we use to determine where they fall on the planning list or the wait list for services. Some of the programs that are available through the Community Care Services Program or CCSP Medicaid waiver include our Adult Day Health Program, our Alternative Living Services, which could be a state licensed personal care home that provides 24-hour supervision, our Emergency Response System, or as people like to call them, my button, I've fallen and I can't get up. Individuals in CCSP can be eligible for home delivered meals, as well as skilled nursing and in-home therapy services, personal support services. So this could include personal care or meal preparation, housekeeping, shopping. Also our structured family caregiver program. So some individuals may be eligible to receive support if they have a caregiver who is providing that primary care for that older adult or individual with disability. And also we have out-of-home respite care, which is another service that's under this Medicaid waiver. So for individuals who may need to provide some respite for a caregiver, we do have that service in this waiver. Couple of exciting things that were funded in state fiscal year 2023, which are particularly important and relevant to the discussion today. It's our Dementia Care Specialist Program, which will launch this year. We did receive $1.25 million in annual funding to develop a Dementia Care Specialist Program where we actually have a trained dementia care specialist in each one of our area agencies on aging. So that person is going to be the local expert in that community to help connect people to services and supports, as well as helping to build partnerships in that community, also helping to organize community education and memory screening events. Additionally, we did receive an additional $3 million in annual funding to begin this year to add 2 additional memory assessment clinics and also to expand telehealth options. So how do you get all of these wonderful services that I just told you about? Super easy. All you have to do is contact your area agency on aging. So I've provided a map here that shows you what the areas are, what counties they cover. We have a 1-866 number that is toll-free, and if you call this number, it's going to help route you to the area agency on aging that is best suited to meet your needs. Also, we have the Georgia ADRC website, which I have shown here, georgiaadrc.com. I did want to show you a screenshot of what that georgiaadrc.com website looks like. This is the home page if you navigate to our website, and you'll find lots of information about us, how to apply for benefits. So if you click on that drop-down menu, it's actually going to give you opportunities to apply for those benefits right here on this website in the comfort of your own home. There's a contact us button that tells you how to contact each one of those area agencies on aging around the state, as well as myself. We also have some frequently asked questions. So individuals can do a bit of their own research, visit the frequently asked questions section, and see if they may be able to find the answer there. We are able to assess needs through our web intake portal. So if someone wants to refer themselves or a family member, they can reach out directly to us and enter their needs and their information, and those will come to us electronically for us to follow up on. You'll notice in the upper left-hand corner, we have our 1-866 telephone number again, just to remind everyone how they can reach us by telephone. And then in the bottom right-hand corner, we have information from our department, our partners, so the Department of Public Health. So if we have older adults or individuals with disabilities who are homebound and unable to leave their home in order to get a COVID-19 vaccination or booster, they can contact us through this portal here, and we can help connect them with those resources. Again, my name is Babs Hall. You're going to have my telephone number, my email address, as well as our website for you again. Please do not hesitate to reach out to me. I love being in the community and helping make connections for people. So anytime you have a question, big or small, you're free to contact me or have a member of your staff reach out to me, and I will get you connected with the right people in the right places to help meet your needs or answer your questions or provide any resources that your community might need. We have about 3 minutes left, so I did want to put our survey link up here so you can scan the QR code or copy the link into your web browser to complete the evaluation of today's session. And I appreciate your attention, and I am happy to, with Lori's help, moderating the comment box. I'm happy to answer any questions that may be out there.
Thank you so much, Babs. We do have a question from Dr. Hales. He says, how long are wait lists for various services, and does this vary across AAA regions?
Excellent question. So the way our wait list services work is it's not first come, first serve. It's based on the individual's need, which is why we complete those screening and assessments. So some individuals can call us today and have the greatest need and the greatest unmet need, so they're able to move into services relatively quickly or immediately. For some individuals, they may just be planning ahead, like we hope they're doing. So they may have a few unmet needs, but they may have some support that's helping to fill in the gaps. And so for those individual, services may take a little bit longer to initiate. But those are all expectations that our ADRC department can help communicate to the individuals and families that reach out for information. It does vary across regions based on population size, funding amount, but we want to do our very best to get people into services as quickly as possible because we know that financially, in the long run, the prevention is what helps keep them at home and safe.
Thank you, Dr. Johnson.
Yeah, I had a question. Thanks so much, Babs. That was really helpful information. Ted Johnson here. I wanted to know, in your opinion, who are the provider offices, the APPs, or the doctors who are doing the best job of linking their patients to services, and how can we learn from those people who have figured out how to help their patients best through available resources? Thanks.
No, that's a fantastic question as well. I appreciate your interest in that. And I will tell you that each one of our 12 area agencies on aging are tasked with going out into their communities, finding their medical providers, finding those offices, and building relationships. They are frequently asking me, how do we do this? We're struggling in our community because we understand that medical providers are busy, your offices are busy, so we want to be as helpful as we can to you. I can't give you any specifics today around who's doing a great job at this. I can tell you that in some of our rural communities where resources may be more limited, for example, down in Southwest Georgia, the area of the state where I'm from, where there's only one doctor in one particular county, they have an excellent relationship with their area agency on aging, because we can't solve everybody's problems all by ourselves, but together we can help make a difference. So anything we can do to help connect you, I'm happy to do so.
One last question from Dr. Hales. What is the most commonly requested or used service with the highest wait times?
So I can tell you, hands down, the most commonly requested two services are housing and transportation. And that is across every population that I have served in the state of Georgia. That includes aging services, child welfare, behavioral health services, intellectual and developmental disability services. Hands down across the state, everybody's asking for housing that's safe and affordable and accessible, and they're also asking for transportation. You know, we struggle in those areas, especially right now with the economy and the current state that it's in. So we're always looking to develop capacity in those areas the best that we can and help connect people to any creative out-of-the-box resources we can come up with, particularly in rural and isolated areas, to help address those two services.
Thank you, Babs. Are there any other final questions? All right. Well, I do appreciate you, Babs, for joining. Great presentation. Very informative. We encourage you to send your patients over to the AAA to access these really great services. Please take the time to fill out the evaluation survey. And please join us next month. We have a national speaker joining us that's going to talk to us about driving. So please mark your calendar for next month. And that is it. Thank you so much, Babs.
Thank you, Lori. And again, the slides will be made available.
Thank you.
Thanks,
I'll
Babs.
send those out.